What should be avoided in motivational interviewing? And also, what's change talk in motivational interviewing? In this video, you'll hear from Sandstone Care CEO Michael Hunter as he explains the common problems that people make when trying to do a motivational interview and how to foster change talk. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges that come with substance use, addiction, and mental health conditions. All right, let's get right to it.
First off, some of the best practitioners of motivational interviewing that I know are parents of adolescents, because adolescents are a beautiful place to practice motivational interviewing. And I think the biggest challenge, especially for parents when they're, if they're really interested in learning this, is that it's easy to get stuck to our own agenda. We have an outcome we're trying to arrive at. We want the solution to look the way we want it to. And the person who is coming to the solution may be evaluating their situation by a totally different rubric, a totally different set of values. And so their conclusion may not look the same as what you want to see them do. And so motivational interviewing is intended to honor the autonomy and the free will of the person that we're having the conversation with. So while we may be stacking the deck in terms of supporting their own arguments for change, it's not a manipulation. Ultimately, this person we're having the conversation with is the one that has to live with the life that they've chosen, not us. And so it can be difficult for folks who are learning motivational interviewing to sort of surrender our own specific agenda in favor of understanding the world through their eyes and supporting them in coming up with a solution that is in line with the values that are driving them. It creates resistance. If you feel like somebody is working to manipulate you, you're actually disrupting your own effectiveness at that point. And so, there's I think it was Thomas Gordon, who came up with what he calls the communication traps, right? And so there are all sorts of potential pitfalls that we can fall into, like closing in on the solution too quickly, premature focus trap, right? Or, and so we do, this is a friend of mine, Steve Brazil, who's also a motivational interviewing instructor, has a really beautiful saying. He says, if in these conversations, if you act like you have hours, it will only take you minutes. If you act like you only have minutes to get something done, it will take you hours. And so with the conversation, there's a natural cadence to it that is productive. And if you rush that process artificially, you'll find that the conversation becomes stilted, you're getting more pushback, and you're going to be less effective in supporting behavior change with those kind of dynamics present in the conversation. But anytime the clinician has a strong emotional investment in the outcome of the conversation, it is going to probably lean more in the direction of manipulation versus motivational interviewing.
Is motivational interviewing just another form of CBT?
No, and it's a common question. They're not the same. They are both gold standard evidence-based models of care for treating addiction. And so I think that we would be remiss if we didn't make sure to identify that these are both incredibly powerful strategies. They operate from slightly different assumptions, and those assumptions are evident in the way that the conversations look. So with cognitive behavioral therapy, typically what you're doing is providing people a framework for understanding how decisions are being made so that people are empowered to make better decisions kind of with this understanding. They can intervene in their own thought process more effectively as a result of these conversations by providing that information. Motivational interviewing starts with almost an opposite end of the spectrum assumption. And that assumption is that the person we're having the conversation with has everything that they need to solve the challenges that they're up against, that it's already there, that it's innately present. And you can support people in exploring their own circumstances, and that they are capable of coming up with solutions that will last and stand the test of time. And so the approach is a little bit different, and it would be easy to interpret what I'm saying as one being better than another, but that's certainly, I don't think, the case. Although with motivational or with cognitive behavioral therapy, the idea is, here, I'm going to give you this kind of system or this way of understanding things so that you can arrive at better decisions. You're empowered to do that. Whereas motivational interviewing sort of is let me elicit the strengths, capacities, skills that you already possess in other areas of your life that you're already quite successful with in other places, and let's draw those out, and you can build on those qualities.
If you want to learn more about treatment options for you, your teen, or young adult, then tell us about your situation on a confidential call using the number linked up in the description box below, or live chat with us at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, we'll get you where you need to go. Be well, and remember that change is possible.